We all know we need oxygen to survive, right?
Right.
But have you ever stopped to think that something we literally breathe every second could also have a hidden side?
It makes you wonder, doesn't it?
That's what we're diving into today, oxygen therapy.
Really digging into it.
And before you think this is just for folks struggling to breathe, trust me, it's way more interesting than that.
Oh, absolutely. It's a fascinating topic that goes way beyond just helping people breathe easier.
So, to help us navigate this deep dive, we have a fantastic expert joining us today.
It's a pleasure to be here.
Thanks for being here.
You bet.
So let's unpack this.
Okay.
When we talk about oxygen therapy, what does supplemental oxygen actually do?
Well, think of it this way. Supplemental oxygen is really all about giving your blood a boost of this vital element, you see.
Right. Makes sense.
Our blood needs a certain level of oxygen
Uh-huh.
to keep all our organs functioning properly.
Yeah.
When it dips below a certain threshold, things can go south quickly.
Oh, yeah.
Supplemental oxygen helps to increase the amount of oxygen that's dissolved in the blood,
I see.
ensuring our organs get what they need. And this is measured by oxygen saturation, which I'm sure you've heard of.
Right, oxygen sets.
Exactly. It's a vital sign in many medical situations.
So it's like recharging your phone, but for your blood. You're bringing those oxygen levels back up to a healthy point.
That's a great analogy. It's crucial in a lot of different situations,
Okay.
not just when someone's having difficulty breathing.
So not just when someone's having trouble breathing. What else?
Think severe anemia, trauma, major surgeries, even carbon monoxide poisoning.
Wait, carbon monoxide poisoning? How does oxygen help with that?
Okay, so fresh air helps, but supplemental oxygen can actually be a lifesaver in this situation. See, carbon monoxide is a sneaky molecule.
Yeah.
It binds to your red blood cells, right?
Yeah.
The very things that carry oxygen throughout your body,
Huh.
but it does so with a vengeance, potentially blocking the oxygen from getting where it needs to go.
So it's like a game of musical chairs, and carbon monoxide is hogging all the seats, leaving oxygen out in the cold.
Exactly.
Wow.
Supplemental oxygen, especially in a pressurized chamber, what's called hyperbaric oxygen therapy,
Right.
acts like a flood of new players, displacing the carbon monoxide and freeing up those crucial binding spots for oxygen.
So it's like sending in reinforcements to rescue the oxygen. You mentioned this helps in other situations too, not just breathing problems.
Absolutely. Take long-term oxygen therapy, or LTOT, for example.
LTOT, got it.
Primarily used for chronic lung diseases, especially COPD.
Now, this is where things get a bit technical for me. I know what COPD is, but how do doctors decide if someone needs LTOT? Like, what are the criteria?
Great question. There are specific criteria, but it really comes down to how well your lungs are taking in oxygen
Okay.
and transferring it to your blood. Two key measurements come into play here, PO2 and SO2.
All right.
PO2 measures the amount of oxygen in your blood, while SO2 reflects how well your blood is carrying that oxygen throughout your body.
So if those levels are too low, that's a sign someone might need LTOT.
Precisely.
Mm-hmm.
And we're not just talking about some arbitrary numbers here.
Yeah.
These guidelines are based on really rigorous research and landmark studies, like the NOT-TT and the British Medical Research Council trials,
Wow.
which really revolutionized our understanding of LTOT and its life-extending benefits for COPD patients.
So these trials were game changers for oxygen therapy.
Absolutely. They demonstrated this critical difference between continuous oxygen therapy versus just using it at night,
Interesting.
which was a big debate at the time.
Yeah, I can imagine.
These findings truly changed the game for a lot of patients.
Wow, it's amazing how much we've learned about something as seemingly simple as oxygen.
I know, right?
But I'm curious, when we talk about delivering oxygen, is it all about those nasal tubes we see in hospitals, or are there other methods?
You're right, there's more to it than meets the eye. We have two main categories, low flow and high flow systems.
Okay, I'm intrigued. Give me the lowdown on these different systems.
Low flow systems, like nasal cannulae,
Okay.
those tubes you mentioned,
Right.
deliver a lower concentration of oxygen. They're comfortable, allow you to talk, eat easily, like subtly sipping on some oxygen-enriched air, you know?
Makes sense. But what about those high flow systems? They sound a bit more intense.
They can be, delivering a much more precise and consistent concentration of oxygen,
Gotcha.
often at higher flow rates.
Okay.
One example is a Venturi mask, which mixes oxygen with room air to achieve a specific concentration. And then there's high-flow nasal cannulae, or HFNC.
HFNC, that rings a bell. I think I've heard of those.
They're quite remarkable, actually. HFNC can provide much higher oxygen flows than traditional nasal cannulae.
Wow.
Because the air is heated and humidified, it's much more comfortable for the patient.
Yeah, I bet.
They've been a game changer in treating severe respiratory problems, even helping some people avoid going on a ventilator.
Wow, that's huge. Avoiding a ventilator is definitely a win in my book. But before we dive deeper into HFNC, I think it's time to address the elephant in the room: oxygen toxicity. How can something our bodies need to survive also be potentially harmful?
Hmm. Yeah, that's the thing, isn't it? It's kind of like anything else.
No.
Too much of even a good thing, like water even, can be harmful. Oxygen is no different.
Right.
And, Priestley, back in the day, had those suspicions.
Yeah.
Turns out he was really onto something. Yeah, when we breathe in oxygen, it gets absorbed into our blood, travels throughout our body.
Right.
Our cells use this oxygen to produce energy,
Right.
which we need to, stay alive.
Right, of course.
But here's the thing. During that energy production process, our cells also produce these byproducts.
Okay.
And they're called, get this, reactive oxygen species. ROS for short.
OS.
ROS. And in small amounts, they're actually helpful.
Really?
Yeah. They played a role in cell signaling, even help our immune system fight off infections. But when there's an excess of oxygen, it's like you're hitting the gas pedal on ROS production.
And too much of these ROS is a bad thing.
It's much of a good thing, right?
Right.
Think of it like this. Your cells have these amazing defense mechanisms, like antioxidants, that help neutralize ROS, keep them in check. But when we're constantly flooded with these high levels of oxygen, those defenses can get overwhelmed. It's like a constant battle between the ROS and the antioxidants. And too much oxygen tips the scales in favor of the ROS. And when those ROS start to build up, they can actually cause damage to our cells, like affecting proteins, lipids, even our DNA.
Wow. Okay, that's not good. But this is all a bit abstract for me.
Hmm.
What does oxygen toxicity actually look like in the real world? Like, what kind of problems can it cause?
It can manifest in different ways.
Yeah.
One example you'll find interesting in the article is called absorption atelectasis.
Absorption atelectasis.
Yeah. Basically, our lungs are like these delicate balloons that need to stay inflated, right?
Okay.
And they rely on a balance of gases to do so. Oxygen is crucial, but it's not the only gas involved. Nitrogen, which makes up a large portion of the air we breathe,
Right.
actually plays a key role in keeping those air sacs in our lungs open.
Really? I never knew nitrogen was so important for our lungs.
It's the unsung hero.
Wow.
Unlike oxygen, which is rapidly absorbed into the bloodstream,
Okay.
nitrogen kind of hangs out in our lungs, acting like an internal scaffolding,
I see.
that prevents those air sacs from collapsing.
Well,
But here's the catch. When you breathe in pure or near pure oxygen for extended periods, it disrupts this balance.
Oh.
The oxygen gets absorbed quickly, but without sufficient nitrogen to replace it,
yeah.
those air sacs can start to collapse.
So it's like sucking the air out of a balloon. Too much oxygen, it throws off the balance, and the lungs can't stay inflated.
Exactly. And this is particularly worrisome during surgeries,
Yeah, makes sense.
where anesthesia and mechanical ventilation can further increase that risk. So careful monitoring of oxygen levels is crucial.
Makes sense. So too much oxygen can actually make it harder to breathe in some cases. That's pretty counterintuitive.
It is, and it highlights why understanding the nuances of oxygen therapy is so vital. It's not just about giving more oxygen, it's about giving the right amount at the right time.
Right.
And speaking of counterintuitive, you're not going to believe this next one, oxygen-induced hypercapnia.
Okay, you're losing me again. Hyper what now?
Hypercapnia basically means high carbon dioxide levels in the blood.
Okay.
You'd think breathing in more oxygen would mean less carbon dioxide, right?
Yeah, you would think so.
But in some cases, like with some COPD patients, it can actually make things worse.
Wait, seriously? That makes no sense.
I know it sounds crazy, but there's a reason behind the madness.
Okay.
So let's break it down. Remember those key measurements we talked about earlier?
VaO2 and SO2.
Exactly. So in COPE, those levels can be chronically low
Right.
because the lungs aren't effectively transferring oxygen to the blood.
Gotcha.
Now, when you give someone with COPD high levels of oxygen, it can disrupt their body's natural way of regulating breathing.
Okay, I'm listening. How does that work?
Okay, so in COPD,
Mm-hmm.
certain areas of the lungs may be receiving very little airflow,
Okay.
but they still have some blood flow.
Hmm.
It's like a traffic jam where the air, the ventilation is backed up, but the cars, the blood flow, are still trying to squeeze through.
Wow.
These areas become less efficient at removing carbon dioxide.
Oh.
When you flood the system with oxygen, it can actually increase blood flow to these poorly ventilated areas,
Oh, no.
leading to a buildup of carbon dioxide in the blood.
So more oxygen, in this case, leads to more carbon dioxide. What a vicious cycle.
I'm starting to realize that oxygen is a lot more complex than I initially thought. It's like a delicate dance, getting the balance just right.
Exactly. And it's not just about the lungs. You'd think the effects of oxygen would stay put there.
Right.
But, this article reveals that it can impact other parts of the body as well.
Now, this is where it gets really interesting.
Right?
Tell me more. What other organs need to watch out? Oxygen affecting other organs. This is blowing my mind.
I thought it was primarily a lung thing.
Yeah, oxygen's reach extends further than you might expect. Researchers have been really interested in its effects on the brain and heart, especially in critical care situations.
Okay, let's talk about that. I'm all ears.
Well, for instance, studies have shown a link between high oxygen levels after, CPR and a higher risk of death.
Really?
It's counterintuitive, right?
Yeah, you would think, giving someone as much oxygen as possible after their heart stops would be like the best course of action.
Right. You'd think so.
Right.
But it turns out that flooding the body with oxygen when blood flow is restored, especially to the brain,
Yeah.
it can actually do more harm than good.
So it's not just about, how MUCH oxygen, but when and how it's delivered.
Exactly. It's like overwhelming a system that's already incredibly fragile.
Right. What about oxygen use in other situations like strokes or heart attacks?
Yeah, well, that's where things get really interesting. I mean, for years, it was standard practice to administer oxygen to anyone suspected of having a heart attack or a stroke,
Right.
just as a precaution, right?
Right. You want to be safe.
Of course.
Mm.
However, recent studies have challenged that approach.
Oh, so what's changed?
Well, several large clinical trials have investigated this, and the results have been pretty eye-opening.
Okay.
It seems that giving oxygen to patients with stroke or brain injury who have normal oxygen levels doesn't necessarily improve outcomes.
Mm.
And in some cases, it might even be detrimental.
Detrimental. How is
Right.
that even possible?
It likely circles back to those reactive oxygen species we discussed earlier. Excessive oxygen, especially when it's not truly needed, can interfere with the body's natural healing mechanisms, potentially exacerbate inflammation and cell damage.
Wow. So it's like we've got to find that sweet spot, that Goldilocks zone of oxygen therapy.
That's a great way to put it.
Not too much, not too little, but just right.
Precisely. It's about recognizing that oxygen, while indispensable for life, isn't a one-size-fits-all solution.
Right.
It requires a tailored approach for each patient, each situation.
Wow, what an incredible deep dive into the world of oxygen therapy. We've journeyed from its life-saving properties to its potential for harm. It certainly made me realize that even the air we breathe is far more complex than it seems.
It really is. And it's a testament to the power of scientific inquiry,
Mm-hmm.
constantly refining our understanding of the world around us, even something as fundamental as oxygen.
Absolutely. It just goes to show you there's always more to learn.
Mhm.
So as we wrap up here, what's the most important takeaway you'd like to leave our listeners with today?
If I had to choose one, it would be this. When it comes to medical treatments, even something as seemingly straightforward as oxygen, informed decision-making is absolutely paramount.
Mm.
Don't be afraid to ask questions,
Hmm.
understand the potential benefits and risks, and advocate for yourself or your loved ones.
Wise words to live by. And speaking of informed decision-making, be sure to check out our show notes for links to additional resources on oxygen therapy. We've curated a wealth of information to help you continue your own deep dive into this fascinating topic.
Mhm.
Until next time, stay curious.